Good morning. So in the last part of our this class, we will discuss about the some of the basic, you can say that, definition. Now, what is agonist? So agonist is the agent which activates a receptor to produce the effect similar to that of the physiological signal molecule. That means what? A agonist is a agent. It is a drug molecule. When it will bind to the receptor, it will activate the receptor, and the physiological, you can say that, what type of activation it is. The activation is similar to that of the physiological signal molecule. What is the inverse agonist? As agent which activate a receptor. It will also call the activate a receptor, but produce the effect of opposite direction to that of the agonist. Now if the agonist produce the contraction, it will produce directly, it may produce the relaxation. So opposite effect. Antagonist, a agent which prevents the action of the agonist. We have discussed about the different type of the antagonist, competitive inhibition and all. So antagonist means it will prevent the action of a agonist of the receptor or subsequent response, but they do not have any opposite action their own. This is important. They do not have any effect on their own. That means they will not produce, for example, the drug, you can say that agonist producing a particular effect, antagonist only the block the action of the agonist. What is the partial agonist? This is the agent which activates a receptor and it will produce submaximal effect, not the normal. It will produce the effect similar to that agonist, but not the whole. It is the submaximal effect. So that is we are calling as the partial agonist. Next is ligand. So any molecule attached selectively to a particular receptor or site. So it may be the any molecule which will bind to the particular receptor or particular site, and terms only indicate the affinity or ability to the bind without regard to the functional changes. We are not considering that what type of the functional changes, how the effect it will produce. No, we are just checking that whether they are having the ability or not, whether they are having the affinity or not. Now here we are talking about the what is the difference between the affinity and you can say that efficacy. Now ability to bind the receptor, if the substance having the ability, capacity to bind a receptor, then that is known as the affinity. And after binding, if they having the capacity to produce the functional changes, it will bind, so it is having the affinity. After binding, if having the capacity to produce the functional changes in the receptor, it is known as the intrinsic activity. Clear? Intrinsic activity or efficacy. So as we have told, agonist means here we are considering as a full agonist. If we are considering as a full agonist, so both the affinity and maximal intrinsic activity, of course affinity has to be there and the intrinsic activity should be maximum. So you can say that intrinsic activity is 1. Clear? Example, adrenaline, histamine, morphine. Competitive antagonist. So intrinsic activity is 0, but they do not have any, they inhibit, they do not have any function and they actually bind, but they will inhibit the effect of the antagonist. So the intrinsic activity is 0. It is the propranolol, atropine, these are the, you can say, the drug. Partial agonist. So partial agonist means similar to the agonist, their intrinsic activity is more than the 0 but less than the 1. More than the 0 but less than the 1, and this is the pentazocine type of the drug. Inverse agonist, in between 0 to -1. That means you can say that in the minus direction, because it is produce the opposite effect. Clear? Opposite effect. Why? That's why we are denoting with the minus sign, because it is taking the opposite effect. So it is in between the 0 to -1. So these are the different definition which we are going to use later on.